CBS 46 News presents Public Affairs on Peach.
Good Sunday morning to you. Thanks for watching Public Affairs on Peach. I'm your host, Adam Murphy. Today's topic, depression. It affects people regardless of age, race, class, or gender. And the recent death of famed actor and comedian Robin Williams has brought the issue to light. Depression can be caused by anything from genetics to traumatic events. And experts say depression can be very dangerous if you don't take it seriously. CBS 46's Christopher King has the story.
Mindy, run for your life! The emotions are coming!
Robin Williams seemed to have it all. Fame, fortune, and an infectious, almost manic sense of joy. But he also carried the burden of severe depression.
Depression can be extremely dangerous.
According to the Centers for Disease Control, depression affects nearly 1 in 10 Georgians. Left untreated, it can lead to self-destructive behavior and suicide.
90% of people who die by suicide have some form of a diagnosable mental disorder, one of the most common of which is depression.
Dr. Nadine Kaslow is the chief psychologist at Grady Hospital and the president of the American Psychological Association. Kaslow tells us severe depression can be caused by any number of things.
Like having a recent loss or breakup, losing a job.
Some of the big risk factors are gender.
Men are much more likely to kill themselves or die by suicide than are women.
And lifestyle.
Like substance abuse, like alcohol or drug abuse.
There are warning signs.
Thinking about dying or thinking about taking one's own life, really hating oneself, feeling terribly about oneself, feeling very guilty and ashamed.
Kaslow says severe depression can be treated and suicide prevented if you catch those warning signs.
The first thing you need to do is talk with them. Let them know you care about them, you're concerned about them, and that there's help for them.
Kaslow says you can help someone who is severely depressed by taking them to a therapist or counselor. Now, there is a Georgia suicide hotline at 1-800-273-8255 and also the Georgia Crisis Line at 1-800-715-4225. Now, if the cost of psychological treatment is an issue for you, each county provides free mental health services. Our first guest today on the program is Jennifer Bartle. Thanks for being on the show.
Thanks for having me. Good morning.
Good morning. Tell us what you do.
I am a program manager at Oak Hill, which is a behavioral health counseling center in Fulton County for children and families.
Now, I understand that more than 90% of people, as mentioned in this story, who commit suicide suffer with clinical depression or another diagnosable mental disorder.
Sure.
That seems astounding.
Sure, and that can be an anxiety issue and sometimes even substance abuse.
And so what is being done at this point in your knowledge to address this issue?
Well, services are provided in Fulton County for anybody, a child or an adult, who struggles with depression, and for families as well. So if you're concerned that maybe your child isn't quite themselves, or your partner or your spouse or a loved one, there are services available in the county to get help.
You mentioned something important, Jennifer. You said someone in your family not quite themselves. I think about this issue and I think, well, what are the warning signs that someone is really suffering from depression? Can you tell me some?
Sure. So sometimes, you know, you or I, we struggle. We have a tough day, maybe even a tough week, but we tend to bounce back. And so depression is different in that it takes a little bit longer to bounce back, and sometimes you can't. So that looks like sadness, hopelessness, worthlessness, feeling like they can't kind of quite shake that feeling, loss of interest in things that they once enjoyed.
And you see on your screen talking about death. You mentioned loss of interest, putting affairs in order, saying goodbye to people. Some of these things are red flags, right?
Absolutely, and they should be taken seriously. When someone starts to talk about suicide and they're at that point where they feel that hopeless, they're asking for help. They're saying, I don't know what else to do. I feel like I've done everything I can do. And that hopelessness can really take over, and that's when loved ones, coworkers, colleagues, friends need to step in and ask those questions. Are you okay? How can I help? And really get them connected to services.
From your experience, Jennifer, when someone talks to another that is suffering from depression and they approach them about this issue, are you suffering from this? Do those individuals tend to talk about their issue, or is it something they bottle up?
I think folks bottle it up. We know that men are 4 times as likely to commit suicide successfully than women die from suicide. So you need to know who you're talking to and reach them in whatever way that you think you can. This is urgent. So if someone's talking about suicide, take it seriously. It's often a true cry for help.
Yeah, and like you said, suicide in the United States, 10th leading cause of death. Men are 4 times more likely, accounting for 70% of deaths. 90% have depression. Mm-hmm. These are alarming numbers.
Absolutely. And we need to be familiar with those phrases. So say depression, talk about it till you feel comfortable talking about it, so that when you go to that other person, you feel comfortable and confident to be able to say, what's going on with you? I've noticed that you're depressed. I've noticed that, you don't play basketball like you used to. I've noticed that it's hard for you to get up in the morning and go to work. What's going on? How can I help?
Yeah, and not only talking to the individual themselves, but going and seeking help for that individual that may be suffering is what you need to do. Mm-hmm. Pretty quickly, mm-hmm. too. Mm-hmm. Because, it's interesting. We talked about Robin Williams here. Here's somebody who seemed to have it all.
Absolutely.
And great success, and really anything he wanted, and he was suffering from something that caused him to take his life, which was so tragic, and move this nation. And it's really terrible, but the fact is, this has brought everyone to really start talking about this and addressing this issue.
Raising that awareness. And these sorts of instances cause us to have some more compassion. So know that people are going through things that they may not talk about, so you look for the warning signs, because they may not feel comfortable or safe, embarrassed, ashamed. There's certainly a stigma associated. So it's up to us to reach out with some compassion and ask the questions.
Let's talk about some of the risk factors that individuals may deal with, common or not so common risk factors. Can you elaborate on that?
If you have a history of suicide attempts, previous suicide attempts that maybe no one knows about, that's a risk factor. If you've witnessed a suicide, if you have substance abuse, if you've witnessed violence in your family or in your community, those are all risk factors.
And so these would put you in an elevated category to having depression, right? Is that what you're saying?
Those would put you in an elevated category for suicide.
I see.
Yes. So as far as depression, that can hit any of us at any time. Certainly there's a family, if you have a family history of depression, you are at an increased chance for being depressed yourself.
Now we also have here on the screen some other risk factors, including firearms in the home, chronic pain, incarceration, exposure to suicidal people. Are all of these things too on the radar? That
can lead to, really, if it leads to that feeling of hopelessness where you feel like that's your only option, then absolutely. And certainly having access to weapons, firearms in the home, medications that are not locked up or not monitored, those are things as well. And when you have any inkling or concern that someone is suicidal, those are the first things you want to do. Remove those weapons from the home, remove those medications, those, especially for children, the sharp objects, anything that they could get their hands on that could help them end their life.
And depression is also something that can be found in children. And you may want to talk about that because our children are our future and we don't want to see them depressed, right? And this happens to them too.
Absolutely. It's the 3rd leading cause of death for adolescents. And that's difficult because teens are moody, right? So they're emotional, they've got a lot going on. There's a difference between someone who maybe their boyfriend broke up with them, or some girls at school don't want to be their friend. That's a sadness, that's a depression that passes. When it doesn't pass is when parents need to get involved. That they're struggling with their schoolwork, they're not enjoying activities that they used to do, they won't come out of their room.
How many days would you say, maybe there's not a specific number of days when you realize this is ongoing, but is there a barometer of some sort where, let's say after a week of constant depression, that this may be a problem?
Yeah, it's about 2 weeks. If you're having these symptoms for more than 2 weeks consistently, daily, you should ask for some help. You should talk to someone about that. And for teens and adolescents, that's a school counselor, that's a favorite teacher, that's a trusted peer at school. For adults, that's their close friends, their coworkers, the people in their church, and certainly reaching out to the community. Fulton County Department of Behavioral Health offers these services, as well as other behavioral health counseling programs in the county.
Jennifer Bartle, great information. Thank you so much for being on the program.
Thank
Very
you
helpful.
for having me.
Hopefully this will help some families that may need it. Now, we talked a bit about depression and also that being an issue in young people. And in just a minute, we sit down with a child psychologist to paint a better picture of what we can do to save our children. The suicide also of Robin Williams has a local father who lost his son to suicide, looking for ways to give hope to other people suffering from depression. Hear his story when we come back. You're watching Public Affairs on Peach.